If you're wearing hearing aids and ever find yourself wondering, are these things actually working, or am I just hoping they are? You're not alone. As an audiologist, this is one of the most common concerns I hear about, especially within the first few weeks of wearing hearing aids. The good news is there are very clear signs that we look for to know whether your hearing aids are doing what they're actually supposed to do. So today I'll walk you through 7 signs your hearing aids are properly working and a few things that may feel strange at first, but that are actually good signs. Sign number 1, speech sounds clearer. One of the earliest things we notice when hearing aids are working well is improved speech clarity. And when I say clarity, I don't mean volume alone. Voices might start to sound sharper, crisper, or more detailed. You might catch subtle inflections or consonants you used to miss. That doesn't mean you'll understand every word immediately, especially in crowded environments. But the overall distinction in speech is a big indicator that your hearing aids are functioning correctly. It's important to remember that hearing aids aren't magic. They won't make speech perfect overnight, but they do make a noticeable difference in how distinct voices sound. If you're noticing these changes, even gradually, it's a very good sign. Sign number 2, your hearing sounds you forgot existed. Many patients are surprised when they start noticing everyday sounds they hadn't heard in years, like the click of a turn signal, birds chirping outside, running water, or even the subtle hum of appliances. At first, these sounds can feel strange or even slightly annoying, but that's completely normal. Your brain has been adjusted to reduced input for some time, and now it's relearning how to process the full spectrum of sound. This adjustment period is actually a positive indicator. The fact that you're noticing these previously faint or missing sounds shows your hearing aids are successfully providing access to sound your ears and brain weren't picking up before. Sign number 3, your own voice. Sounds different, and that's normal. Another common experience. New hearing aid users notice is how their own voice sounds. It might feel louder, echoey, or just unfamiliar. Many people worry that something is wrong, but in reality, this is one of the most typical early experiences with amplification. Why does this happen? When your hearing was reduced, your brain adjusted to hearing your voice differently. Now that hearing aids are amplifying sounds, your perception of your own voice changes. This usually takes a few days to a couple of weeks to feel more natural, and it's a clear sign that your devices are providing the sound levels your ears need. Sign number 4, conversations feel less exhausting. Have you ever walked away from a conversation feeling drained because you had to focus so hard just to understand what was being said? That's listening fatigue, and it's incredibly common for people with hearing loss. One of the most encouraging signs that your hearing aids are working properly is that conversations start to feel less tiring. Even if you still miss a word here or there, your brain isn't straining as much to fill in the gaps. A question I get all the time is, how much better should my hearing be with hearing aids? The honest answer is that hearing aids don't restore normal hearing. However, when programmed and functioning correctly, most users experience about a 50 to 80% improvement in everyday communication, particularly in understanding speech. That improvement shows up in clearer conversations, less effort to follow discussions, and fewer misunderstandings. If you're noticing that listening feels easier, even if it's not perfect, that's exactly what we expect when hearing aids are working well. Sign number 5, you're asking for fewer repeats. Pay attention to how often you say what or ask someone to repeat themselves. Even a small reduction in these moments is a meaningful sign that your hearing aids are helping. Hearing improvement is usually gradual. It doesn't always come in dramatic leaps, but the subtle changes in your daily life, like catching a word here and there without having to ask for clarification, are important indicators of progress. These improvements may feel minor at first, but over weeks and months, they add up to significantly better communication and confidence in social situations. Sign number 6, background noise is present, but manageable. Many people expect hearing aids to completely remove background noise, but that's not realistic. And honestly, it's not desirable either because we still need to hear environmental sounds for safety and awareness. What we're looking for is balance. Background noise should feel less overwhelming, and speech should be easier to follow within that environment. If you find that noisy restaurants, busy streets, or crowded family gatherings feel challenging but manageable, that's a clear sign your hearing aids are functioning as intended. Hearing aids are designed to provide clarity and focus, not to mute the world. Learning to navigate sound in different environments is part of the adjustment process, and noticing manageable improvement in these settings is a positive sign. Sign number 7, your audiologist can verify performance, especially when hearing aids are new. Beyond how things feel subjectively, we also rely on objective verification. Audiologists use tools like real ear measurements and functional gain testing in sound booths to confirm that your hearing aids are delivering the correct amplification for your specific hearing loss. These verification processes are especially important during the early stages of use. They ensure your devices meet prescriptive targets and give your ears appropriate access to sound. As hearing aids age, other factors like internal wear, microphone sensitivity loss, or older processing chips can affect performance. Even when testing looks acceptable, speech clarity and background noise handling may decline over time. That's why ongoing evaluation combined with your real-world listening experience is essential to ensure your hearing aids continue to work effectively. Important reminder, hearing aids are not a set-it-and-forget-it solution. Adjustments are expected and improvement happens over time. Consistent use, proper programming, and regular follow-ups with your audiologist are crucial. If something feels off, it doesn't necessarily mean the hearing aids aren't working. It often just means they need fine-tuning. Whether it's minor volume adjustments, program changes, or adapting to new environments, these tweaks are part of the journey to better hearing. If you're really unsure whether your hearing aids are working properly, the best next step is to schedule a follow-up with your audiologist. And if you want more clear, honest explanations about hearing loss, hearing aids, and what's normal versus what's not, make sure you subscribe to Hearing with Dr. Stapleton. You don't have to guess your way through better hearing.